Ankylosing spondylitis, or AS, is a chronic inflammatory condition that mainly affects the spine and sacroiliac joints, also referred to as SI joints, which are located at the base of the spine. It can be challenging to diagnose because its symptoms often mimic other conditions. To diagnose AS, doctors follow several steps, including clinical evaluation, imaging studies, laboratory tests, and ruling out other conditions. Let's break down each of these steps in more detail. Step 1. Clinical evaluation. The first part of the diagnosis is a detailed medical history and physical exam. Your doctor will ask about your symptoms, such as if you have back pain that's chronic and usually starts gradually, often in the lower back or hips. The pain tends to be worse at rest and improves with exercise. Your doctor will also ask if you have stiffness in the spine, especially in the mornings or after periods of inactivity. If your pain or stiffness has been going on for at least 3 months and tends to improve with activity, that's a red flag for AS. Your doctor will also ask if there's any family history of AS or other related diseases because AS has a strong genetic link. This gene is found in about 90% of people with AS, so if you have it, it increases your chances of developing AS, but having the gene alone isn't enough to diagnose the condition. Finally, during the physical exam, the doctor will check how well your spine moves, using tests to measure flexibility. They might also check for tenderness in the SI joints. These are at the base of the spine, where the sacrum and pelvis meet, and they're often inflamed in AS. Step 2. Imaging studies. Once the doctor suspects AS, they'll turn to imaging to confirm the diagnosis. Here are the most common tests. X-rays. Initially, X-rays are used to look at the SI joints for signs of inflammation. Early on, these changes may not be obvious, but as AS progresses, the X-rays may show joint damage, narrowing, or bony growths, which are signs of the disease advancing. MRIs. An MRI is more sensitive than X-rays and can detect earlier signs of inflammation, especially in the SI joints or spine, before permanent damage occurs. This is important for diagnosing AS at an early stage when treatment can be most effective. CT scans. In more advanced cases, CT scans may be used to get detailed images of the bones and joints. Step 3. Laboratory tests. While there's no single blood test that confirms AS, certain lab tests can help support the diagnosis. Doctors may do a blood test to check for the HLA-B27 gene. As I mentioned earlier, this gene is found in most people with AS. A positive HLA-B27 test doesn't mean you definitely have AS, but it's a strong risk factor. On the other hand, not everyone with AS will test positive, and most people with HLA-B27 don't develop AS. So, of all individuals who carry the HLA-B27 gene, only about 5 to 6% will develop AS over their lifetime. Of all individuals with AS, 10 to 20% do not have the HLA-B27 gene. Doctors will also do a blood test to check inflammation markers. Tests for C-reactive protein, or CRP, and erythrocyte sedimentation rate, or ESR, are used to check for signs of inflammation in the body. While these tests can be helpful, they're not exclusive to AS and can be elevated in many other conditions. Step 4. Ruling out other conditions. There are a number of other conditions that can cause symptoms similar to AS, such as mechanical back pain from muscle strain, for example, rheumatoid arthritis, which usually affects peripheral joints, psoriatic arthritis, and enteropathic arthritis, which is linked with inflammatory bowel diseases. Part of the diagnostic process involves ruling these out, which is why your doctor will ask about your history and might order other tests as needed. Once ankylosing spondylitis is diagnosed, long-term monitoring is crucial to assess how the disease progresses and to guide treatment. This typically includes follow-up visits with your doctor to check your symptoms, monitor your disease activity, and get repeat imaging like X-rays or MRIs to assess how the disease is progressing and to make adjustments to treatment as needed. Diagnosing AS involves a combination of a detailed medical history, a physical exam, imaging studies, and lab tests. Early detection through imaging, especially MRI, is crucial for managing the disease before permanent damage occurs. Ankylosing spondylitis can be difficult to spot right away, but with the right tests and a careful evaluation, doctors can make an accurate diagnosis and start treatment. Once diagnosed, ongoing monitoring helps keep track of disease progression and guide treatment. If you think you may have AS, or if you're at risk, don't hesitate to consult a healthcare provider. Thank you for watching. If you found this video helpful, please give it a thumbs up. It supports the channel. Don't forget to subscribe and get notifications for updates and informational videos about ankylosing spondylitis. And leave a comment. We would love to hear from you.